Happy Monday. I know it's probably been a little bit of time since Catherine and I have actually gone on the internet and shared hopefully some useful knowledge today. We're going to tackle Medicaid, not in your traditional sense of what you can do and how you apply for it, but actually looking at the dollars and cents of it. Because in the end, we're seeing in Colorado less and less people, less and less communities that are able to accommodate low income. And to me, that's a problem. And so Catherine and I wanted to jump on and see if we can start a discussion around doing it a little bit better for older adults, because I've said it numerous times. No matter the socioeconomic of our older adults, they all deserve the same level of high basic aging care. And not a la carte, but same high level, no matter their socioeconomic status. But before we dive in, Catherine, why don't you give them a little taste of what we have coming up on February 10th and 11th?
Yeah. So first of all, I agree with you. Everybody deserves high quality care. February 10th and 11th, we have our event, Collaboration in Aging, and this is a collaborative event across every aspect of senior care. It is in person at the West in downtown Denver. We would love to have you attend. We are taking all of the precautions. We have a certified pandemic compliance officer on staff. You can check out our podcast that we did with her. That's on our website as well. So come check it out or reach out to us if you have any questions. And this is one of the topics that will be at the event. That we have some specialists there who are going to be talking about Medicaid, Medicare, how to manage your finances. And that will be from the specialists from Beneficent, who are there to educate. And today we're going to look at the inside scoop, sort of the inside dollars and cents around this, with the goal of helping educate what it looks like from an operator's perspective, so that we can get people thinking and talking about what can we all be doing differently.
I think that's correct, because I don't think it's a one-size-fits-all solution here. It can't just be a policy-driven decision. It can't be on the operators. It can't even be on the family members, right? We have to have this creative approach to how we benefit our older adults who have low income, period. And we can't go back to whatever the status that we're in of we're running out of beds, or they've got to be at home and family have to step up. We've got to look beyond those solutions to get more creative.
Yeah. And on the family side, I would say it's really hard to put that burden on family if you're already low income, because that family has to be out working. This is a tough situation, and there's no one size fits all answer. There's no one sort of silver bullet response to it, but there is the opportunity to look at it, get educated, and start getting creative together and working collaboratively. So Francis, share some of the knowledge you have.
I think we just kind of start real from the high level stuff, is just generally, what is Medicaid? I mean, every state has different requirements. I want everybody to know that we're going to talk specifically about Colorado from an operations standpoint. Every state might call it something different. Medicaid is a very common term that is used to grab everybody. Elderly, blind, disabled is the predominant what they call waiver in Colorado. And a waiver just means you check the boxes. You meet all the eligibility requirements to be able to get your waiver. And we wanted to share some of those. So I'm going to do a little screen share here about, some high level stuff. Again, we no way am I a Medicaid expert, which is why we're having someone such as Beneficent that's at our event. I know enough just from looking at, the numbers and from attacking it from that manner that kind of helps. But we're going to share this first screen here. It's from benefits.gov, and we're going to put all these in the show notes. But this is a really good spot to go to get some of that initial information on Medicaid. And as you can see here, it's who is eligible. I'm not going to read off, but you can kind of see, and we're really focusing on this group right here, that's 65 years of older, as you can see. And there are income limits. And as we can see, that's not a lot of money. And there are some other assets that we will talk about down the road, but even at 4 households, that's not a lot. Catherine, what's your take on that? To me,
I mean, that scares me
Yeah.
because if it's one person in the household who can't make more than $17,000, I don't know where you could live in Denver where you could even afford to be living, not be homeless. And if you look at, you had it on 4 people per household,
Mhm.
right?
Yep. 4
And
right there.
something like 35,000. Yeah. So it's really, I just, there's a big problem here, and there's a big gap between what is realistic, even at the core basic level for humanity, and what's being offered. And I know that it's not an easy topic because there's a lot of complex issues in the government and what can be paid and who should be paying it, and so forth. But that's not much money for somebody. And then to have them move into a home or some sort of care, what does that look like then for the operator? And
Exactly.
I have to say, I talk with a lot of operators, and I don't know any of them who aren't in this business because they care or because they don't care. They're in the business because they actually want to serve people. And I just think it's going to be really difficult if they're not able to recoup costs. It's not
Yeah.
about making money on Medicaid, it's about recouping costs.
Yeah, and I want to bring this up because and there's additional asset calculations, not just the income that you need to look at. And as you can see here, they
Right.
don't want you to have much, right? It's can't exceed 1,500. I mean, exempt up to 1,500. I mean, retirement accounts. There's obviously more complexity to this, but if you look at it, it's not. And the problem here too is that for a lot of our older adults, if they do move into community, your home isn't your primary residence anymore. So that completely changes everything, right? And it makes it even more complicated and challenging to navigate this realm. And so, it's really tough. And I think that's the frustrating part. Is I know a lot of operators, we want to take low income, but when you start looking at the economics of it, how do you provide that high level of care for the right dollar amount? And how do you put a price tag on what someone's care is worth? And it turns into both, I think, an internal and external challenge to marry those two together, right? You have to have the ability to make a revenue and that's sustainable.
You do, or you can't be in business. So how do we allow people to be in business? They have care staff to pay. They have their own operating expenses to pay. And if we don't have people in business servicing our Medicaid
Mhm.
population, then that Medicaid population suffers even more.
Yeah.
And so while we don't have answers here today,
Yeah,
we're
we don't have
really
answers
looking
yet.
for,
Yeah, there's a
right,
solution. Every problem has a solution.
always, and probably multiple solutions, and it's going to take some collaboration.
and and as Catherine was talking there, I pulled up what they call the as you can see here, the EBD January 21, 22 rate schedule. This is where the state of Colorado, under Medicaid Department of Finance, sets the different reimbursement rates and modification factors and so forth. There's a lot of, I didn't say a lot, there's some nuances to how it works, but what I really want to draw everyone's attention to is, I had it and I missed it, is the alternative care facility. ACF is what it's called. And
What does that mean while you're looking for it?
alternative care facility. It's how it's defined. Sorry, right here. It's how Medicaid defines it as assisted living memory care. It's not skilled nursing. So it falls into, in Colorado, it falls under the assisted living and the memory care licensure opportunities. And in Colorado, to be licensed as a secured memory care, you have to pay additional license fees and also take additional trainings. Maybe have your doors have to be secured from an unexpected walkout, not necessarily, just someone that wants to unexpectedly leave out that door and might not be safe to navigate the world on their own without a little bit of guidance. But the hard part in Colorado is that the reimbursement is identical. It is, as you can see here, $90.36 a day. Now, Before that, though, I want to draw everyone's attention. Before January 1st of 2022, it was $67.91. So I just want to put that out there. I mean, it was very low, quite frankly. And when you look at, I just kind of did a number game here just to try to play with something beforehand. Is I looked at, let's assume that you have 8 Medicaid, you only have 8's the max, right? You have 8 Medicaid residents at for 30 days at that reimbursement per day is $90.36. So that entire month, you would have only $21,686.40 in gross revenue. So that means that's all you're collecting, because even though there is a copay from the Medicaid participant, it just lowers the amount the state pays. It doesn't go above and beyond.
Okay. So to an average person, $21K a month for 8 residents sounds pretty good.
It
So
does.
how does that get spent?
So let's break it down to a day real quick. So let's assume it's $90 a day times 8 residents. That means I get $722.88 a day. That
Okay.
does, to the average household, that is a lot of money. And I don't want to downplay it in any capacity. But what I want people to think about here is, what do you want your care to be? Do you want it to be hands-on? Do you want it to be intimate? Do you want the caregiver to know you from a personal level? Or do you want them just to rush around and kind of be there to touch? Kathy, I got 15 minutes for you. And then Francis, I got 15 minutes for you. And God bless them, because that's not the problem. The problem is looking at it from a bigger picture. So I'm going to make math simple. I'm going to look at 2 different rates that someone makes. Let's say $15 an hour and $20 an hour, okay? And let's assume we want to do the best care possible. That means I want 2 caregivers during the day for 12 hours, and I want 1 caregiver overnight. So I want a total of 36 hours of care a day.
And that's for all 8 residents.
All
right?
8 residents. So those 2 caregivers during the day will, share for that. Let's say the overnight, kind of, since it's a little quieter, you could be okay overnight. But I want people to realize there are some places that you do need to run to overnight to do it the right way and the best way. And that could be 48 hours of care. So that can change the numbers dramatically. So let's make math super simple here, because I like it simple. 36 hours of care at $15 an hour. That's $540 a day in care costs, not counting employer contribution of Social Security, unemployment, all of that stuff, workers' comp, insurances, all of that. That's just what the gross wages would be for a caregiver. Now let's take it to $20 an hour, $720 a day in care costs.
So in that world, you've just eaten all of it up, and you don't have anything for overhead, including the mortgage on the home or, facility costs related to that. And so what happens when you have, let's say you drop that down to 1 caregiver in the day and 1 caregiver at night? What does that look like in terms of the quality of care for those 8 individuals?
I think it depends on the level of care they need. If they're really able to do a lot of it on their own, it might not have a huge impact, right? It might not, right? But if you're talking someone that has cognitive issues and memory care issues, it could be dramatic, because now you might be burning that caregiver out from 8 people that need a lot of hands-on or intensive care. You might have high caregiver turnover because you need to pay as close to 15 as possible, right? But then how are people going to improve and grow with your company if you can't give what raises, right?
Right.
Or what if you're looking at, food costs? We haven't even talked about food costs, right? We haven't even talked about electricity. We haven't even talked about insurance costs. We haven't even talked about activities, engagement, furniture. We haven't talked about the part that makes it their house.
Yeah.
All we've looked at here is just the wage for a caregiver.
So as an operator, as you are, what do you do about this in order to be able to stay in business for the Medicaid? I know you have private pay as well, and maybe that helps compensate, but how does one manage to be able to do this?
It's hit or miss. You've really got to have almost no exposure to it, because otherwise your staff, again, I got into this business because care mattered more to me than anything else. Yeah. I never wanted to jeopardize the care of our older adults. I had watched my grandfather, with Parkinson's, my other grandfather with dementia, care matters, and how we treat our direct care staff matters. And overloading them with 1 to 20, 1 to 15, 1 to 10 to make Medicaid work, it's not fair.
Yeah.
It's not helping the direct care team who's giving their all, like literally selling everything they have emotionally, physically to be the best they can be. And that's not fair to older adults, but it's also not fair to the people who got in the business to serve as well too. So I think it's balancing it, but balancing it both on the number of private pay, but then also on the acuity level. And that's why you're seeing less and less Medicaid memory care beds in the state, because the care is so high and the reimbursement is so low.
And so that puts if there's reduced Medicaid beds for high acuity memory care, that actually puts families in a really tough position, because they end up being the ones who provide the care 24/7. And
right. Yeah.
Go ahead.
Yeah, no, you're right. It turns into this family burden.
Well, and that means that those people are unable to work, or they're leaving a loved one home in a dangerous situation by themselves. And then in communities, having watched my mom in a community with incredible care staff in a private pay community, still one caregiver for 8 people would be really, really tough, because every person, especially with memory care and dementia issues, everyone's different and they require different care. And if there's somebody, I remember this very clearly, if one person is agitated, one resident is agitated, they tend to all get agitated. It's just the energy. And that can be really, I mean, I don't know how one caregiver could manage if one person is combative and another person needs to get a change of their pants. Like, what do you do? How do you decide who has the higher priority right in that moment? I think it's setting us up for really poor quality of care. That's why everyone's afraid of what we all think of as the old time nursing homes.
And that's where we're pushing everybody, though, Catherine. I mean, that's sadly, that's where we're seeing people go, and it's the catch-all. And it's, as I look at this, I put this little comment up here. If you run how I would, that's $2.88 a day left over. I can guarantee average food cost per person per day is between $5 to $7. Because you can buy in bulk and meal plan and you're looking at $40 to $56 a day alone in food.
Yeah.
And again, I haven't touched water, haven't touched electricity, haven't touched gas, haven't touched any overhead of mortgage, insurance, stuff like that.
Yeah. I find it very eye-opening. So as a member of sort of the general public, not understanding how all of this works internally, I find this really eye-opening and educating to understand that. And what that does for me is, one, it inspires me to continue to try to solve these issues in the senior care world. 2, to be more empathetic and more understanding. And I always try to be empathetic, but this really gives me that sense of, like, we have this tendency to say, well, $700 a day, you should be able to manage that. That's a management issue. That's a, efficiency issue, but it's really not when it comes down to, this is physical labor. There is no other way around this. This is physical labor, and it has a certain requirement to it. And I suspect that the outcomes for these individuals, the care recipients themselves, is probably shorter life, certainly less quality of life.
I mean, how do you put efficiency on when you need people, right? I mean, it's one of those challenges, right? That a lot of industries can innovate by tech, right? You hear McDonald's wanting to go with less staff because they're putting in automation and all that stuff, which is great, right? You do your own ordering in a kiosk. Grocery stores now are having more and more self-checkouts. So you need one person to man 12 self-checkouts versus 12 people to manage 12 registers, right? I mean, that's great. Can't do that in senior care. It's
only to the degree that you can automate things that are rote processes, okay, but you can't automate hands-on, and you cannot take away the human factor. That's the whole point of the legislation, even around person-centered care. And nobody wants to put their loved one somewhere or have their loved one live somewhere where it's all robots. And
well, because we want human touch. Take COVID aside. If I trust you, if I see the same face day in and day out, and I know that you're there to be my support, not do it for me, but we do it together, right? We navigate this journey you're on, whether it's a 5-year journey, a 10-year journey, a 3-day journey, right? But you have to be able to look me in the eye, in the face, and go, I feel comfort with you. I trust you to help me get my day started, whatever that looks like.
Oh, we just lost Francis. I
Oh,
think
we
he's
just lost. Yep.
There we go.
Am I back?
Yep.
Okay. We see a new person every day, over and over again. How do we build that trust?
Yeah. And it's trust with the care recipient. It's also it's trust with the care recipient. It's also trust with the family. So if you don't, you keep freezing there, Francis. But if the family sees new caregivers all the time in there, they don't know who is providing care for their loved one. So it's a tricky topic. So as we said, this particular podcast is really to just shed some light on some of the internal workings. If we can understand what's happening together, then maybe we can put our heads together and think about things that we can do to make changes. Small changes, big changes, medium-sized changes, all of them. It's going to take more than one thing. There's no magic wand to wave here. So we challenge you, put your thinking cap on, get creative, talk to people about this, especially if it's something that you're passionate about, or you have someone in your life who is potentially going to need some Medicaid help as they get older. Let's start thinking about this, and definitely join us at the event February 10th and 11th and hear directly from some experts at Beneficent about this.
And I absolutely think you spot on. I think we have to look beyond our own borders as to solution, other states, other countries, other places to come up with creative solutions. I think now is the time that we start fresh. Again, we have a system we have to work with. So I don't mean that. I mean, start with a fresh perspective. Let's step back and not just say, okay, we've got to raise the reimbursement up. That doesn't, there's only so much money that the government has and that we can do.
That's what makes it complicated.
Exactly. So I like what you said. Let's join us. This is a needed discussion. And it's only the start of a topic in a way that we have to look beyond what we think we can solve, because everything has a solution. And it's time to push and challenge ourselves and get uncomfortable on how we get there. And so please, share your messages. I mean, if you're watching this on review, share some thoughts, share some ideas. Let's get a discussion going about, hey, how we could start to tackle this.
And do you own, run, manage, or have you worked for, or do you have a loved one in a Medicaid facility where you think that they're doing some great things? Please share.
Yes.
We're all about the bright spots. When we see something that is really working, we want to put a huge spotlight on it to show others that there are other ways to do this, and we can all learn from each other. So please do share your stories. We want to hear them.
Absolutely. So until next time, we will see everybody soon. We'll see everybody February 10th and 11th in Denver, Colorado at the Westin downtown. But until then, stay healthy, stay safe, and continue to push the envelope on what you want to do and how we can solve things.